Greetings to everyone. Now, knee pain is a joint degeneration issue. We handle medical treatments at the early stage. In the intermediate second and third stages, the joint becomes deformed. As I mentioned, the hip and knee joints can become misaligned, making it very difficult for patients to walk properly. Sometimes patients in advanced stages can walk with significant deformity. We can see them walking with a lot of bending and leaning, so it is essential to start medical treatment early, progressing from surgical methods to injection treatments. Only surgery provides a complete solution. This method has developed significantly over time. Sometimes, despite the advancements outside, it can still be managed with medications and physiotherapy. So, joint replacement surgery is the solution for this. Without this joint replacement surgery, it is considered normal. Up until now, the surgical convention we have been following has shown that joint replacement surgery has a success rate of almost 90 to 95%. If we take joint replacement surgery to a global level, knee joint replacement surgery is the most commonly performed procedure. It also has a success rate of nearly 90 to 95%, providing significant benefits. Scientific studies have shown that the success rate is quite high, around 98.95%. So why is this the case in surgery? There is a need for that 5% margin. To achieve nearly 100 out of 100, certain technologies and medical techniques are required. This is where the robotic joint replacement surgery comes into play. So, how effective is joint replacement surgery? What is the importance of robotic surgery in achieving complete success? This will be discussed in detail in the upcoming video. Warmly welcome all of you to Bone Fracture Hospital. Are you talking about scientific studies? All studies focus on the joint, and we perform surgery accordingly. After the surgery, we will proceed with the necessary follow-up. We do this to ensure everything goes well, so pain management will significantly improve. They want to return to their old condition. They should be able to walk well. Good posture is also important. For such individuals, simply reducing pain is not enough. Their livelihood should also return to the previous state. They need to be healthy and able to walk well. They should engage in regular activities and be able to ride a bike. Even if they are around 65 to 70 years old, they want to be able to ride a bike and work, perhaps in a farming job. There is a teacher, but they think they should be able to climb up and down the stairs. So even as they age, they have this mindset of wanting to regain their youth and return to their previous state, which makes the role of action important. Even if patients have undergone surgery and are doing well, are they completely satisfied? Scientific studies indicate that after surgery, nearly 20% of patients do not achieve a satisfactory outcome. There are many reasons for this. One way is that the old condition remains unchanged. For a short period, it may feel good, but while walking, it feels painful. It feels like there is no balance in the leg, unlike the old times. If this is taken into account, they will return to their previous condition. If you look at it, there are 10 to 20% of scientific studies showing this 10-20%. They are not satisfied. The surgery was performed well. Although the operation was a complete success, 80% of people are not satisfied. When we look at why they did not achieve satisfaction despite the surgery being done well, there are some subtle aspects to consider. For instance, the internal and external balance must be maintained. Just like when we drive a car, if the alignment is correct, it will go straight. Similarly, there needs to be a certain degree of balance. Even if it feels off, we may not notice it in a very subtle way. The knee functions well and the alignment is good. Those who observe it closely will do it well. When we conduct tests and check, we realize there is a small problem that needs correction. Right now, it is functioning well, but there is a vibration that suggests it is pulling to one side. When walking, we may not notice that even a millimeter of misalignment can cause pain, either on the inside or outside. If there is even a slight looseness of a millimeter in that area, it can feel like that. So is it in millimeter precision? With this kind of precision and technological advancement, we can ensure that people are satisfied and achieve 100% success in joint replacement surgery. It is a life-changing surgery. It not only reduces the pain, but also helps them return to their previous condition. Then their life changes. So they come back to reclaim their youth. In this joint replacement surgery, if you look at it, the robotic surgery has less pain compared to the normal joint replacement operation, so the pathway is reduced as fewer issues and open joints are placed for that. When you see it, it's perfect. We will decide how to proceed with this. That's how we will do it. After that, it won't be possible. Therefore, the potential for infection, blood loss, and pain all become apparent. So if the pain is manageable and they can quickly bend and stretch their knees well, they can walk soon. Those who need to stay in the hospital for a week can manage with just 3 to 5 days. So they return to their normal state quickly, and that's all there is to it. This robotic surgery plays an important role in joint replacement surgery. In this case, we perform open surgery, and almost half the amount is required for robotic surgery. So why is there a need for less in robotic surgery? If you ask why it requires less, when you look at these instruments, in knee joint replacement surgery, the knee and thigh bones need to be shaped to fit those joints. During that design process, we need to use such large instruments. There is a proper way to do it. On one side, there is balance on the other side. So when we align it, it shouldn't just be a simple adjustment. It should be properly balanced between the inner and outer sides, and there should be a team that correctly aligns the hip and knee with the ancient axis. For international standards, there are additional developments that can be commonly used for better results. So the equipment will be quite significant. When this is substantial, if you look at our feet, it will change dramatically. If women come and are this large, they can make a big impact in this place. If you look at what's below, the injuries can be this significant. And sometimes they can be quite severe. You may not be able to fit this properly. There is a chance for human error to occur, leading to a 1 millimeter discrepancy when moving back and forth. It can be said that this can happen. That 1 millimeter can lead to a 20% miss in action. All of this has been scientifically proven. So this is it. There aren't any large equipment here. There is no need for such big equipment. We don't need to make such a big fuss about it. So we can just use a small tool like a pen and draw on it like a pen, and then we will correct the drawn areas accordingly. That's how we will do it. After that, the fittings are done properly for the service. So this is an important advantage of robotic surgery. The second important aspect is that we clean the bones without cutting them, just like we clean them thoroughly. We clean them, and what happens then is that when you look at it, it will fit perfectly with excellent precision. Therefore, these joints are correctly aligned. This is evident just by looking at it. We all know this. We are familiar with the 3 dimensions. Now we are doing things based on what we see. However, the difference between robotic surgery and traditional surgery is that robotic surgery allows us to understand beautifully what motions need to be made before the joint explodes. For instance, if you look at this, it can be done on the outer side or the inner side. It can happen on the outer side or the inner side. Sometimes it can go down and sometimes it can go up, similar to maintaining balance. How can we manage everything? By just touching it a little. So sometimes in this area, it comes before the 10. If you look at the back sometimes, the joint seems to be getting bigger. This is how it will be inside the bones. Sometimes we have done it at the correct pace. The millimeter measurements come in, and we cut and clean the bones before fitting the joint. We can know in advance that this person is going to have a joint issue. As I have mentioned in many posts, I feel like I am building a house and this place is somewhat cramped. I think it would be better if this place were a bit larger, but I won't do anything to fix it. It would be nice if there was a bit more space here, like putting in a animation to make it look larger. I think everything will be fine, so let's come right away. If we give the engine and say it's broken, we will immediately fix it. There is applause now. It would be good to be in this place. Did you see if there was a light here? Everything is about searching for the lining. This robotic surgery method is the pinnacle of that search. In this process, we plan to cut and clean the knee bone before we even attach the joints. So, when we apply it, the excised joints will be fitted. This fitting is done broadly, and it also addresses the knee pain. Because of this fitting, it becomes effective. When balance is correct, pain will be less. So, it won't just be about having less pain. A properly aligned joint must remain accurate to the degree without even a single degree of deviation for it to function well. If the joints are well maintained for the long term, they can function without pain, movement restrictions, or complications for up to 25 years. This means that the pain is significantly reduced and the wounds are smaller with less blood flow. More importantly, proper positioning of the implants is crucial, and excellent mixing techniques are employed to ensure optimal outcomes. It is essential to monitor the situation closely and take necessary actions. Only if there are this many degrees within that definition can there be a degree that lasts this many years. However, knowing that its lifespan will decrease, we adjust it accordingly. That's why what I'm saying is that the long-term survival, meaning the lifespan of the joint, should not be uncertain. More importantly, while doing all of this, it should be properly aligned both here and there, on the inside and outside. When in a balanced position, there will be no pain on the inside. There won't be any issues on the outside either. It will feel very loose, like when wearing loose shoes. So we need to correct that. If the alignment is loose, there will be movement as well. Some people experience pain in different areas, so this can all be related and can be addressed easily. The joint is avoided in robotic surgeries. We have the opportunity to screen for mistakes, and there is no chance of making errors. After that, we will examine this properly 3 times. Sometimes these joints can cause issues, and for some, an external rod is recommended. This can affect the area around the knee at times. Sometimes we have interruptions. So when we come to a conclusion, we see that in robotic surgery, we have a planet screen. Before taking any action, we ensure that we have planned properly and confirmed that the balance is equal on both the inner and outer sides before proceeding with our joint surgery. This way, our joints will fit correctly. We will have a balanced soft tissue structure, as we mentioned. After that, when a stable condition is achieved without any issues, the joints may work excessively for years, and our knee might feel normal again, as if it were the old knee. In this context, it is important to note that during normal joint replacement surgery, we aim to align the knee properly and perform a balance check. We are unaware of what happens in between, and this is the state that is typically present in conventional joint replacement surgery. But this robotic technology is quite advanced. It means that the knee extension is happening in a controlled manner. So what happens in the balance of the extension and flexion during this process? Is it loose? It could be stable in the context of the mixture. So there could be times when it is in between, however it may be. This can only be seen as a problem beyond human eyes in conventional surgery. So to solve this problem, we definitely need a technology. If there is a misalignment of even 1 millimeter on the inner and outer sides, it can be acceptable. However, if it exceeds 1 millimeter, it will cause us trouble. We will create a pathway where one side is loose and the other side is tight. Therefore, we can primarily check if it remains perfectly aligned from the time of knee extension to the full range of motion. If you look at this, it is the inner side. So extending the knee with a good balance is important. When you look at it later, the action is almost evenly balanced on both the inside and outside. It was about 2 millimeters. As I mentioned, we can accept it up to 1 millimeter. So this is about 2 millimeters, and it is almost evenly balanced like a square, matching like sandalwood. It matches like this. So this matches about bending and extending the knee. When that thorough full range is present and in a balanced state, you won't feel any discomfort in your knee. It feels good. After undergoing surgery, people often experience pain for a day or two, and many struggle with this when they are very tight in this area. This is why some people avoid joint replacement surgery or operations, fearing the pain afterward. Robotic surgery helps solve these issues effectively, and even if conventional surgery is performed well, robotic surgery can address problems that arise. It's important to note that robotic surgery is not limited to just knee replacement. It also includes hip joint replacement and bone fracture treatments. Shoulder and knee arthroscopy are also evolving in this field. Regardless of how technology advances, when robots created by human hands and minds work in conjunction with the doctor's hands, it significantly benefits the patient's health. If doctors and robotic joint surgery work together like two eyes, there will be no obstacles in the patient's path. This kind of robotic surgery can help restore the patient's life and youth. Regardless of the position, please feel free to contact me without hesitation. Thank you and best regards. Our hospital staff will work diligently and compassionately with you at every step of your progress, from the moment your illness and pain are identified until you achieve complete recovery. Everyone should receive everything. Everyone should live a life without obstacles. And for you, there is Balabone Fracture Hospital in Tirupur.